Hello, I'm Dr. Anil Gudi, and I'm a consultant in reproductive medicine, surgery, and assisted conception at Fertility Plus and at the Homerton Fertility Center. So let's go back to the topic of endometriosis. So for ages, what have we believed? We believe that either there is a problem with oocytes in endometriosis, or there is a significant problem with the endometrium. And over the past 2 decades, we have either tried to correct getting the right number of oocytes, or we've tried to correct the endometrium by suppression. And what this paper looks towards is a slightly different subject. And what it is looking at is do the embryos that are created in endometriosis, do they have a lower potential of implantation if they are euploid? So that's the key. So if you have a euploid embryo, then you are changing the focus and saying, does the endometrium now dictate the success rate or not? So that's why it's a reasonably interesting paper and something which will get us thinking again. So endometriosis is probably one of the commonest diseases that we see. Probably between 5 and 15% in the reproductive range, 30 to 50% in the infertile range. And the proposed mechanisms of poor oocyte quality is probably about poor oocyte quality, alterations in the composition of follicular fluid, impaired endometrial receptivity, oxidative stress. Some studies said less euploid embryos, lower implantation rates, and then in some cases, if you move to a frozen cycle, success rates got better. So between January 2016 and March 2018, a retrospective cohort study of IVF cycle. The group 1 was surgically confirmed endometriosis, and group 2 was a control. And the control, you had either ART for single gene disorder and male factor infertility. All cycles were vitrified and frozen cycles, and the protocol was either giving the OC pill for suppression, estradiol intramuscular, oral, vaginal, and transdermal, depending on what they wanted to use, and progesterone was injectable of 50 milligram in oil. So if you have a look at the results, the live birth rate with endometriosis was at 61%, male factor 49%, and a single gene disorder was 52%. If you look at the implantation rate again, endometriosis did not go lower. If you look at pregnancy loss, you see the same. You see that endometriosis is very similar to male factor and in PGTM. So this is something which probably will get us back to the question of what is the role of the endometrium here. And patients with endometriosis has had similar outcomes compared to controls. The fertilization and the blastocyst formation rate were similar. And the number of good quality blastocysts was similar for biopsy in patients with endometriosis. And if you look at the outcomes of aneuploidy in the series, and around 1,873 good quality blastocysts were biopsied. Aneuploidy rates were very similar compared to the controls of the male factor and the endometriosis. So let's go back to different ways of thinking that we all do. So there are many studies which have been done on endometriosis, and they're varied. There are studies which say there is an impact on oocyte quality, and there are studies which say there's no impact on oocyte quality. Equally, there are studies which say that if you downregulate, your oocyte quality is better, and there are others which say that you don't need to downregulate and the oocyte quality is not changed. The thinking was that the increased free radicals, which are the inflammatory markers and inflammatory response, can directly damage oocytes in embryos. There are studies which have shown that endometriosis can produce less number of mature oocytes, but there's no doubt that surgical treatment of endometriosis lowers AMH and lowers antral follicle count. So there is a logic there in thinking. And despite all this, a large study, which was age-matched, showed no change in aneuploid rates, and that was again done in 2017. Also, I think one of the things which we need to have a think about is endometrial receptivity altered when you put in endometriosis, and putting back a euploid embryo allows us to think about it. And there are some studies which do indicate that giving GnRH agonists, long prolonged course of GnRH agonists or OC pills, with the thought that this may normalize the endometrium, cell formation, aromatase production. Probably we're not entirely certain of that yet. And I think the evidence about changing the endometrium by giving 3 months of suppression or 4 months of suppression is still, there is a bigger question mark. This study does not suggest implantation, and this study to some extent gives a reassurance to couples with endometriosis that if they can have a euploid embryo, there's a good chance of a live birth. So that's in short about endometriosis. Again, questioning of whether there is a challenge to oocyte quality. And this study says probably no. Do women with endometriosis have a lower chance of producing euploid blastocysts? And the answer is no. And is euploidy which will determine the best chance of a live birth rate? And the answer is probably yes. So thank you very much and see you next week.